All right, I'm looking at my patient's chart. So it looks like my patient today is Sam Johnson with a date of birth of 18XX. She has no known allergies. She's a high fall risk, and she's also a full code. It looks like Sam Johnson was recently admitted to our medical surgical unit, and her diagnosis was dehydration after falling and being found by their son at home. Looks like her weight is 145 pounds, and her height is 5'4", so she's within healthy normal range. It looks off like from the handoff report. Oh, also before I keep going on, it looks like for her past medical history, she has hypotension and asthma. It looks like for medication, she has furosemide, 20 milligrams by mouth daily, an albuterol inhaler, 2 puffs is needed for shortness of breath. Acetaminophen, 500 milligrams is needed for pain. And again, for the handoff report, it looks like for the assessments, the vital signs came in all within normal range. General appearance alert and oriented, no cardiovascular issues, breathing sounds clear and unlabored. She has normal bowel sounds. It looks like her extremities are pink and warm, and she has equal movement in all 4 extremities. It looks like she has an IV in her right arm, and again, she's a high fall risk. And for pain, she has some soreness from falling, but no broken bones. Now I'm looking at my MR, and it looks like Sam Johnson's furosemide was already given today at 7:30, so it's not due until again tomorrow. Her albuterol inhaler was already given, is only given as needed, so we don't need to give that. So it looks like today we're giving 2 medications. The first one being Fluzone, 0.5 milliliters intramuscular injection, which will be her annual flu shot, and then the heparin, which will be 5,000 units per 1 milliliter, which again will be our anticoagulant to help prevent blood clots. All right, so I have all the information I need. I'm gonna go and orient my patient. So, knock, knock, knock. Open the door. Close door. Provide privacy. Perform hand hygiene. All right. Hi there, my name is Amanda. I'm going to be a student nurse today. Can I get a verification for name and date of birth?
Sam Johnson, 18XX.
Perfect. And I'm just verifying that with your wristband, and it looks like it's right. Right, perfect. How are we feeling today?
I'm okay. I'm sore.
Oh, I bet. Well, I'm sorry to hear that. I do have some 2 medications to give you today, but before I go on with that, I need to ask, do you have any known allergies you're aware of?
I don't.
Okay, perfect. Just wanted to make sure about that. All right, so today I do have 2 injections to give you. One will be intramuscular, and another one will be subcutaneous. The first one, which is going to be the intramuscular one, is going to be your Fluzone, which again is your annual flu shot. And how it works is that there's basically dead antibodies of the flu, like that is like in the medication, and it's injected into your body, which helps promote antibodies to help fight the flu. And since you are in the more immune compromised group for your age, you are more susceptible of giving the flu and getting more adverse reactions from it. So this is why you need to take it every year. Some adverse effects, side effects that can happen from the Fluzone is that it can, cause a mild fever 2 days post injection. It can cause some swelling and irritation near the injection site, and redness and soreness, and possible bruising. But if that happens, just let us know and we can get that sorted out, okay?
Mm-hmm.
And there's different spots in which you can get the injection done for the intramuscular. So again, it can be your deltoids, it can be your vastus lateralis, which is your outer thighs, and it can also be your ventricularis, which is back over here. It looks like for the most convenient spot, the deltoid is usually the most preferred. Is that okay with you?
Yep.
All right, perfect. So that's the spot we're gonna do. Do you have any questions about the Fluzone?
Does it cause the flu?
Actually, that's a great question. It's a big misconception, but it actually does not cause the flu. This is an upper respiratory. This is for the upper respiratory flu. So it's a prophylaxis medication. So it cannot physically cause you the flu. So yeah, I hope that helps with clearing things up.
Yeah.
All right, perfect. So with that being said, I also have a second medication for you today, which is going to be your heparin, and that's going to be given to you subcutaneously. And heparin is an anticoagulant, so basically that means is that's going to help prevent blood clotting. And since you're currently immobile a little bit right now due to your fall, this is going to help prevent blood clotting in your lower extremities. Okay.
Okay.
And some of the adverse reactions that can happen with the heparin is that it can cause some bleeding, anemia, soreness, and bruising, and sometimes a little bit of fatigue as well. But if anything that happens, just let me know, okay?
Okay.
All right, and then also for some injection stops for subcutaneous injections is that we go for the adipose tissue. So usually it's in the abdomen and the back of the upper, in the upper back, lower back, back of the arms. I was under the impression, or at least I saw on your MAR, that you were already given this medication yesterday. Where was it given, if you mind me asking?
My stomach.
Your stomach? All right, so we're going to be administering subcutaneously in your stomach. That's okay?
Yep.
And since you are obese, this is the most adipose tissue that we're going to find, so that's perfect. Do you have any other questions for me today?
I don't.
All right, perfect. I'm gonna go get your medications prepared. Your bed's in the lowest position. Your railings are up, and your call light's right there. So let me know if you need anything.
Okay.
All right, I'm gonna perform hand hygiene. I'm gonna leave my patient's room. All right, now I'm in my med cart, and I provide privacy. I'm in my med room, and now I'm gonna get some gloves. If I can get them out, perfect. All right, now I'm gonna start with my first med checks. Before I start my med checks, I'm first gonna examine my medications to make sure there's no tamperedness and the expiration date's good and the color's good and no discoloration. And I do not see that. The expiration date looks good for the flu zone, so that's good. And again, I'm just gonna check the heparin. Expiration date is good, so it's good to be given. No discoloration, and does not look like it's been tampered with, so these medications are good to go. So now I'm going to start off with my first med rights for the flu zone. So again, the flu zone is for Sam Johnson. Sam Johnson in the flu zone, it's going to be given 0.5 millimeters. The dose is going to be 0.5 milliliters. It's going to be given intramuscular injection. Intramuscular injection. The date to be given it is now, so we're going to give this her medication now. And the indication is that this is her annual flu shot, and since she is in the more immune compromisable group for getting the flu, needs to be given, so that is good. That completes my first of the med rights. And then for my heparin, again, the heparin is for Sam Johnson. The heparin, it's going to be given 5,000 units per 1 milliliter. It's going to be given subcutaneously. It's going to be given now, since it says that she needs to be given it now, so we're going to give it to her now. And again, for the indication for the heparin, it's an anticoagulant, so it's going to help with preventing her blood clotting. So, perfect. We did our first set. Now I'm going to start by preparing my medications. A little tight. Okay. Now I'm going to first start off by preparing my flu zone, my intramuscular injection. So again, I'm going to take out my sterilized syringe. Perfect. And then I'm going to take out my blunt needle. And again, I'm going to make sure that it all stays sterilized throughout the procedure. Okay. And I'm going to screw on the blunt needle into the syringe. There we go. Take the cap off. And since we're going to be administering 0.5 milliliters, I'm going to air up 0.5 milliliters within the syringe. Perfect. And now I'm going to inject the air. Oh, but before I do that, I'm going to first recap this really quickly. I'm so sorry about that. I'm going to recap this and wipe down for 15 to 30 seconds, just because I took my cap off and I want to get off any dirt or possible germs that could be on the top of it. Right, that's been about 15 seconds. And again, I have already filled up the air. And now I'm going to inject the air into the vial. There we go. And now I'm going to get 0.5 milliliters of the flu zone.
The fast stroke glue.
Sorry, there was a big bubble. I'm just trying to get them all out. All right, I'm gonna put this down. You put on the cap, and then I'm just gonna get the little tiny bubbles out. Just flicking little tiny bubbles. We just want to make sure there's not any big bubbles so that we can get this in a safe manner. Alright. So that should be 0.5 milliliters. Alright, perfect. So I have 0.5 milliliters of the medication. And now, again, since it's going to be given intramuscular, I need a 25 gauge and a 1 each needle in order to get all the way into the muscle. So I have this open. I'm going to take off my blunt. Oh my goodness. Also, I would also use the scoop method when I put it back on the thing. So that is my mistake. I'll make sure to use the scoop method while I prime my needle. So again, I took this off. And then, again, keeping everything sterile, I'm going to put this on. Right. Then I'm just gonna prime it. Put this right down. I'm just gonna look for a drop. Right, I see a drop. Now I'm just gonna use the scoop method to recap. Which can be a little tricky, but we got it. All right, now we got it on, so there we go. And now I'm gonna make my tag for the flu zone. So again, this is the flu zone. It's going to be given intramuscularly. It's for Sam Johnson, date of birth of 1/8XX. It's going to be given now, and it's going to be 0.5 milliliters for the dosage. So I'm going to just put that on here. All right, and now I'm just going to perform my second right to the meds for the flu zone. So again, this is the flu zone for Sam Johnson for the flu zone. It's going to be given 0.5 millimeters for the dosage. It's going to be administered through intramuscular injection for the route. It looks like it's going to be administered now, so we're going to give it to her now. And again, for the indication for the flu zone is that it's going to be for her annual flu shot, and she's in the more immune compromised group for her age. This needs to be given to her. So that completes my second rate for the flu zone. So now I'm going to start preparing my second medication. I'm going to first dispose of my equipment, change my gloves. Put a new set of gloves on for hygiene. Alright. So again, I'm gonna do the same type of procedure. Move this out of the way. I'm gonna take out my sterilized syringe. Alright. And just so I don't forget, I'm going to again wipe this top down for the heparin for about 15 to 30 seconds just to make sure no germs come in contact with it. Alright, perfect. I'm just gonna throw it away so it doesn't get in my way. Alright, so again, before I put on my actual needle, I'm going to use the blunt needle to draw up the medication. And again, making sure that everything stays sterile while I put it on. There we go. So again, since we are going to be administering 5,000 units for 1 milliliter, we're going to draw up air of 1 milliliter. It's a little strong. There we go. Alright, so I dropped up 1 milliliter of air, and now I'm going to inject it into the vial of the heparin. Here we go. And now again, I'm going to drop 1 millimeter of the subcutaneous heparin. Again, trying to just not get any big bubbles. We can tap up the little ones. And now we're gonna use the scoop method. There we go. Safe. Now again, we're just gonna get out any bubbles. Looking any bubbles. There's a big one right there. Sorry, I did not realize there was a little bit of a bubble. I'm just going to redo this really quickly just because I don't want any big bubble to be in the vial or in the syringe because that could tamper with how we administer the medication safely to the patient. Okay, that looks a lot better, I feel like. Again, using the scoop method. All right, that actually looks a lot better. So again, this is 1 milliliter of the heparin that we're going to be giving subcutaneously. All right, perfect. Now again, for the subcutaneous injection, we want to use a 5/8 inch needle with a 23 to 25 gauge. So we're going to use a 25 gauge with a 5/8 inch needle. And since our patient isn't obese or have any abnormalities, this is fine to do so with the patient. Otherwise, if the patient was a little bit bigger, we would use a 1 inch. And this will be at a 45-degree angle we're going to give it to her at. Right, I'm going to put this down. And again, making sure it stays sterile. All right. Now Now we're gonna prime our needle. Watching for a drop. All right, I saw a drop. And again, we're gonna use the scoop method. There we go. Just so we don't cut ourselves, we don't want that. And then I'm just gonna dispose of this equipment first really quickly, and then I'm gonna make my name tag for the heparin. So again, the heparin. It's gonna get given subcutaneously. It's gonna be 5,000 units per 1 milliliter. It's given for Sam Johnson with date of birth 18XX, and it's gonna be given to her now. So that's perfect. I tag on, and now I'm gonna do my second rites of the medication. So again, this is for Sam Johnson, and again, this is for the heparin, and the heparin's gonna be 5,000 units per 1 milliliter. Yep, 5,000 units per 1 milliliter. It's gonna be given to her subcutaneously as the route. It looks like it's gonna be given to her now because she needs it now. And again, this the indication is that she needs it for as an anticoagulant, and it'll help her from getting blood clots. So we completed our second rites for both medications. Now we're gonna take all of our equipment and go into our patient's room. Again, knock, knock, open door, close door, providing privacy. I'm gonna put my MAR on my screen quickly. My medications down. And also, I would make sure to put on my gloves just to stay sterile. And then I'm gonna reintroduce myself to the patient again. Hi there, my name's Amanda. I'm a student nurse today. Can I get verification? Oops, both name and date of birth.
Sam Johnson, 18XX.
Right, perfect. Let me just check one more time your wristband. Right, that looks good. All right, Sam Johnson. So I'm back again with your medications, and I'm going to give you the first one. It's going to be the intramuscular, but I do need to ask one more time. Do you have any allergies?
I don't.
All right, perfect. Just wanted to make sure again for clarification. So now before I do any of my medications, I'm going to first go through my third rites of both medications. So again, I'm going to go through the Fluzone again, right? So the Fluzone, put this one down. So again, the Fluzone is going to be for Sam Johnson. Sam Johnson is the Fluzone. It's going to be given with a 0.5 millimeter dosage. That's going to be given to her subcutaneous. I mean, not subcutaneously, intramuscular for the Fluzone. Sorry, intramuscular injection. It looks like she's going to be given to it now, so we're going to give it to her now. And again, for the indication, she has not been given her annual flu shot yet this year, so we need to give it to her, especially since she's in the more immune compromisable group. So that's that. And I've clicked my third rate for that medication, and then until like documentation. Now we're gonna go through the heparin. So again, the heparin for Sam Johnson, and again the heparin is gonna be 5,000 units per 1 milliliter, 5,000 units per 1 milliliter, perfect. And again, it's gonna be through subcutaneous injection. We're gonna give this to her. It's due now, so we're gonna give it to her after we administer the intramuscular injection. And again, the heparin is an anticoagulant, so it's gonna help prevent blood clotting. And I will complete my seventh rite once I administer the medications. So now I'm gonna bring my little card over here. Just to make sure I can make this easy. Thank you. All right. All right, Sam, so I'm gonna start off by first administering your intramuscular injection of the Fluzone, okay?
Okay.
And something you know about this injection is sometimes it can have a burning-like sensation, especially if we tension up our muscles. And I'm going to clean from inner to outer in a circular motion. So just make sure when I'm giving you the medication, try it and like not tense up your muscles, or else it could hurt a little bit more. Okay?
Okay.
All right. And again, I'm looking at the skin before I inject, just to make sure there's no lesions or signs of irritation before I inject it. It looks good. And again, I'm gonna use the 4-finger rule from the scapula just to make sure we don't hit any bones. So we're gonna administer over in this section. Okay, perfect. So we're gonna do that. Would you also want me to do a countdown for you?
Sure.
All right, perfect. So again, I'm uncapping my top. Put this down. And again, just wanna make sure I have a good grasp on it. We're gonna use the C-tug method. So we're gonna pull back the skin. And I'm going to be administering this at a 90-degree angle. So again, C-tug. And I'm going to count to 3, okay? So 1, 2, 3. Inject it. And then I'm going to be administering this slowly so it doesn't have so much of a burning-like sensation. All right, there we go. And then I apply pressure if the patient was bleeding, and then I would also put a Band-Aid as well. But the patient's not bleeding, so he's good. And then I'm gonna safety this. How are we feeling, Sam?
I'm feeling okay.
Okay, good. So now I'm gonna dispose of this. I'm gonna put this here and put this in the sharp spin. And then I would take off my gloves real quickly and document. And I already did scan in the flu zone, right? So the flu zone is scanned in, and I just push that and administer it. So that completes and like for my documentation of the 7th rate for the flu zone. So we are good with that. And then I'm also going to scan in my heparin, so beep gets on the system. And I also already did scan in the patient, but we can scan her in one more time. Beep. So she's in the system. Everything's good. So now I'm going to get my gloves again to administer the heparin. All right. Again, I don't know why I keep picking the worst gloves for this, but we will make it work. All right. Now, Sam, we're gonna be giving this to you, this next injection subcutaneously, and it's gonna be in the lower the abdomen 2 inches away from the belly button. Okay.
Okay.
Okay. And again, I'm gonna provide as much privacy as I possibly can. So we don't want to expose our patient too much. And again, I'm going to sanitize the area before I inject the heparin. And again, inner to outer motion. And again, I'm palpating the skin just to make sure everything feels all right. No signs of abnormality, so we are good to go. And again, would you want me to do a countdown for you?
Sure.
Perfect. And again, we're going to be giving this to her at a 45-degree angle since she is not obese, and we can do it in a 45-degree angle. All right, so I'm going to count the skin. All right, here we go. 1, 2, 3, and the bevel is up as well. And then inject it slowly. All right, and I apply pressure if she was bleeding. How are we feeling, Sam?
Good.
Okay, perfect. And again, I'm gonna safety the needle. Perfect. We heard the click, so that means it's good. Throw the syringe away. Put this into the sharp spin. I'm gonna dispose of my equipment. Throw away my gloves. And then I would document that I had just given her the heparin. So again, we administer both medications. I would stay with my patient. Whoops. I would stay with my patient and assess if she's having any adverse reactions for a couple of first minutes, and then I would leave for 15 minutes. Okay, Sam. So it's been about 5 minutes I've been with you since the injections. Are we still feeling okay?
Yep.
All right. I'm gonna come back in 15 minutes to reevaluate. So if you need anything, your bed's in the lowest position. Here is your call light, and I'll be back. Okay?
Okay.
Okay. So I'm next in the patient's room, and I'll perform hand hygiene too before I leave. So open the door, close the door, knock, 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 open the door, close the door. I'm gonna perform hand hygiene again. Hi there, my name's Amanda, it's me again. Can I get verification of your name and date of birth?
Sam Johnson, 18XX.
Perfect. Yep, and that correlates with your wristband. Hey, so I'm here to ask you, how do we feel since our 2 injections?
I feel good.
You feel good? No adverse reactions so far?
No.
Okay, that's good. I'm just also gonna check your injection sites and palpate the areas a little, just to make sure that it all looks fine, okay?
Okay.
Okay, thank you. Okay, perfect. So again, it looks good, no irritation. Yep, okay, it looks good, no irritation. All right, so, and I'd also reassess your vital signs and look at lab work to make sure everything is good and within normal range. And looks like we are all good. Do you need anything from me?
Nope, I'm okay.
All right, perfect. Well, if you need anything, your bed is in the lowest position. Your hair is your call light. If you need anything, just let me know, okay?
Okay.
All right, have a good day.